Hey folks, welcome back to another episode of The Change Physician. This is your host, Dr. Kevin Cuccaro, with my co-host, Dr. Melissa Cady, and today's fantastic guest is Dr. Rip Patel. Dr. Patel is an ER physician who's got some fascinating backstory, has contracted with hospitals, does a lot of teaching, very passionate about underserved populations, but that is not what we're going to talk about in today's episode. What we're really going to talk about is COVID from the physician perspective. So Dr. Patel, thank you for coming on to The Change Physician. And would you just mind telling people a little bit about your background and your story before we dive into the episode?
Yeah, sure. My name is Rip Patel. I live down here in Houston. I do part-time academics at the Baylor College of Medicine here in Houston. I've been with the residents there teaching since 2014. And then I do full-time locums work. I started in a community job with a big staffing company. Was not the right road for me for being a physician, practicing medicine, wanting to do optimal patient care. So started doing a little locums with agencies and then sort of formed a little independent group directly contracting with small rural critical access hospitals around the country. And it's just been really rewarding. It's been fun. I've really enjoyed my practice, my lifestyle, and bringing a skill set to really parts of the country that need it, which I think couldn't be more relevant now with coronavirus, where you're really stuck in places where you're the only provider. We have patients boarding in the hospital for hours, sometimes days. You're kind of running a mini ICU/ER while you're waiting for transfer. And so it's really been a great experience and really getting to put your skills to the test in places I think that really need it the most.
So let's start there, because you're on the front line in the emergency department. There are a few other places that you are going to have as much exposure potential as that environment. So could you kind of go back to, say, March, where we're now, early March, when we're kind of recognizing that this is something different here. What was your thoughts, feelings, and what were your experiences in the hospitals back at that time?
Yeah, I think in March, nobody really kind of knew what was going on. It's funny, I remember the first case I had was in Missouri, and we saw these two people come in that were very sick, and really everyone's trying to figure out what to do. Should we quarantine them? As I'm in the room with my nurse gowning up, we see them kind of walling us off into a corner, and we're both like, how are we going to get out of here? And those patients ended up having the flu, actually. But I mean, between the PPE, the treatment, I don't think remdesivir was even around then, who to admit. It's just amazing how physicians have really stepped up and learned and share information about how to manage it now. But I think from there to the escalation to getting sick, and I got COVID in April, and I know exactly how I got it. One of my friends said it best. He was like, you let your guard down just once. Unfortunately, in the ER, when you're in a high-risk setting, you're at risk for getting it. But I had a patient, I was going out to get lunch for my residents at the county hospital here, and there was a guy seizing on the ground, coughing, and he was vomiting everywhere. And, when you're seizing and vomiting, you can aspirate. And so my tech is there, and he's like, "Guy, can you help me?" And of course, I ran up there, and a couple people did, and the guy's just coughing. And I didn't even think that I took 1 second to take a breath with my mask off, and he ended up being COVID positive. And then I think like 3 days later, I just hit me like a freight train. Yeah, so that was it. I got really sick in April for about six days total.
Yeah. Can you explain, just give a little detail on like what that experience was like on a day-to-day basis as a patient?
Yeah, of getting COVID, or just,
Right.
yeah. So when I got it, I generally don't get sick, and I don't have any medical problems, but it hit me hard. And I felt the fever coming on. And then between that, fever wouldn't come down. I had one of those temperature guns, and so I hit the gun on me, and it was like 104. And then it was really just in bed. I mean, it's incredible. I know everybody experiences COVID differently, but it knocked me out. I think I slept 18 hours a day. I had no energy. I had no appetite. You sweat. I sweat like crazy, and I sweat through every part of my bed. At one point, I was literally just on the floor because my whole bed, not to get crass or gross here, but it was just drenched in sweat.
Wow.
And that was kind of the low point of lying there on the floor with the high fevers. And I think, like all bad physicians, we don't want to seek help. Now, luckily, I had a portable pulse oximeter, so I was able to check my temperature, check my oxygen levels, and I stayed, above 90%. And so at that point, we were still under the understanding, and still to now, that you probably can write it out at home. But it was really terrifying, between the chest pains, the body aches, the fevers, the weakness. And then somebody slipped out to my parents, because I hadn't talked to them in a few days. My poor mom like masked up and tried to get into my home and knocked on the door. And I'm like, go away, like step away from my house. I will be fine. So now my parents do daily, they call them life checks now, because I live alone. And so they're just making sure I'm alive.
Wow.
But after it resolved, then I got a massive headache. It was so bad, I thought I had meningitis. I mean, my head was going to explode. And so once again, I did what you shouldn't do, and I didn't get evaluated, which I probably should have. And then thank God it went away, and ended up being okay. But the post-COVID now, I was just telling you guys earlier, I saw my family doctor today, and I think anybody that's had COVID should go see their family physician for your checkup, because a lot of people have kind of post-COVID syndrome where they get malaise, fatigue, headaches, forgetfulness. It's something we still don't understand. But I think I got lucky in that sense. I have a little pleuritic chest pain in the mornings. It goes away, a little bit of fatigue. But it really changed my perception. I think somebody once told me, you're not going to really understand a patient's condition until you've sort of been through it, experienced that condition, experienced that disease. So
Yeah.
And I think that's important to kind of highlight here, because that was April is when you contracted COVID. And as we're recording this is December 28th. That's 8 months really of still having symptoms. And I want to make sure we're aware of that, because there's this idea, if you're young and healthy, that this is a fairly benign condition. Now, granted, you didn't pass, you didn't have a stroke or anything,
yeah,
but the shock to your system was pretty profound if
yeah.
your body is still recovering at this time. So yeah, I mean, have you seen that with your patients in the ER, that younger people are still having pretty heavy duty symptoms, or are you having any complications with younger patients that were concerning?
We are. And a lot of it, I think, is just we don't understand. If people having COVID, then they're out of the 14-day window, and then they come back a week or two later with hypoxia and shortness of breath, or with infiltrates, or the fatigue, the malaise, the dehydration. So we're seeing all these post-COVID symptoms of people that we still don't fully understand how the virus kind of lingers in the system, or what is actually going on.
Yeah. Yeah, there's a lot to learn, in light of the fact that not only see it as a physician, but experience it as a patient.
Yeah.
What have been you go to several different locations, and we know that in this country there's a percentage of people that somehow want to call it a hoax. Any thoughts or comments about that
Yeah.
phenomenon?
It's really frustrating. It's so challenging when you're seeing physicians, administrators, nurses putting their lives on the line, literally. And I mean, I see a lot of COVID patients. My nurses probably, and the respiratory therapists, I mean, get the most exposure. One of our dear friends in New Mexico, actually didn't see him last week, and he's like the sunshine of our ER. And I was like, where is he? And they were like, he got COVID, and he's older and he has medical problems. He was hospitalized, and boy, he put his life on the line, taking care of some of our sickest COVID patients. But you try to educate people, and you try to see all ends of it. People's businesses are shutting down, don't have jobs, but I don't think everybody understands. And I did a more medical mission work pre-COVID, and we live in a great country with hospitals that have electricity and medications and these things you may not think we have faith in having: EMRs, records, EMTALA laws. But I don't think people understand what's going to happen when that faith is gone, when you go to the ER and they can't see you, when you need a bed and there's no beds available. You expect to have a bed, you expect to get seen. And when the point, aside from how deadly COVID is, and the post-COVID syndrome and the hypoxia and the suffering, I mean, seeing the suffering people go through getting it. I love my mom and dad to death. My mom has a hard time wearing masks, and I keep telling her, I'm like, you don't want to get it. The suffering is unbearable to watch people go through. But when there's no beds, because every hospital is full, ICU beds are full, I think that's what people need to understand, that we just don't have the capacity for all these people. The healthcare system just can't manage it. And it's causing the adverse effect of doctors burning out, stressed out, You know, I take an attitude. Yeah, I get really stressed out. I get upset at times, but I'm just like, you do the best you can. You literally, that's all you can do. I've had nightmarish days where there's no capacity I can manage all this, and it literally comes down to triage medicine of the sick people. Everybody else waits, and anything else happens, nurse come grab me and tell me who is sick. But you just do your best. But I think if people focus on that part, that the system just cannot handle it, and it's getting to that strain, and it gets really scary when, like what happened in Italy. And so I hope people, that's what I try to educate people on, aside from all the debunked myths that people perpetuate about COVID and this and that.
Yeah. Yeah, I think it's interesting because, you know, out of sight, out of mind. It's easy for people not to believe something. I think it's double compounded by the fact that you can't see the virus in the air,
Yeah.
the way that our eyes work, and so it's hard to believe that. And then if you're not in the trenches like you are, and you're staying confined in your home, and you might have a certain sliver of news that's flashing, you know, the opposite information. It's really easy to see how people can be misled and have a
Yeah.
hard time believing that what you're just telling us is actually happening. But anyone that knows anybody or that works in that field, it's just like, I think anything else that we deal with, people, it's understandable that people don't understand the type of strain that even the system had before COVID in its own way, because it's definitely not a perfect system. But yeah, I
Yeah.
think
It's just a lot of, I think, misinformation. I don't know how science and politics got intermeshed. I don't know how this concept of questioning something as basic as a mask even arises,
yeah,
or masks as a right to not have it. It's so beyond my understanding of how people could think in this mentality. And like I said, when people are that kind of stubborn, you have to find some way to try to explain or educate and make them try to understand. I think when I tell people the strain capacity and the resource capacity, it gets through a little bit better. But you know, places I've worked in rural parts, I think people have been pretty good. It's been pretty, you know, when I walk in the room and the patient has their mask off, I'm like, you need to put the mask on, please. I don't get fights or pushbacks. Or I tell patients now, this is a pandemic. So, you know, we do a lot of, I call shared decision making. If you don't really need to be in the ER, you need to ask yourself if you really want to stay in the ER. You could get your x-ray for your ankle sprain here. Do you really need it? Could you get it as an outpatient? Do you want to risk getting COVID-19? Because the ER is a hotspot for it. And so in that sense, it's been good. I think people have been more receptive to what's going on.
yeah.
That kind of brings up a little bit different point here. Is I'm wondering, what are you seeing in the ER? Because my wife works urgent care, and in the early in the COVID pandemic, it was very curious because so many of the people that come in for routine things like, you know, ankle sprains, things that you would like,
Yeah.
probably you and I would not go into the emergency room or even the urgent care for. So I was just, have you seen has the population changed that's coming into the emergency department, or is it pretty similar as it was pre-COVID?
You know, it's interesting. Like everybody, this year's job market was interesting because I do a lot of references for my residents, and they had a very hard time finding a job. Part of that was the pandemic. Volumes went down because people aren't going to the ER. They're sort of realizing maybe I can wait this out because of the pandemic right now. So volumes went down. I think now they're slowly starting to come back up. But when I was working in Missouri, I think every other patient was shortness of breath COVID. Um, I was about to lose it on that ship because I'm like, when are we going to run out of remdesivir? When are we going to run out of steroids? When are we going to run out of, how many more patients can these hospitals take? You just keep dumping them and dumping them and dumping on them. And I'm just like, when are they just going to say enough? I don't know. New Mexico and Texas, I think, have been a little more mixed, a little bit of everything. We're still staying, sadly, like the heart attacks, the strokes, a lot of the psychiatric side of pandemic, of quarantining, especially a lot of the geriatric population that are just sad because they can't see people. But it's really been a lot of COVID. It's exhausting. It's tiring. I did emergency medicine because I like variety, and it's just unfortunate for many reasons just to constantly see COVID patients coming in. But I think the trick now has become just figuring out stay or go. And are they like a COVID, just needs an X-ray and a test? Are they a go home, or are they a you're really really sick? And then beyond the sickness, how far are we going to go with it? But we've gotten so much better at our management of it, which has been great.
Yeah. As far as the general management, you kind of gave an idea of kind of like the, figuring out what to do. What's generally being used? I mean, at this point in time, things can change, of course, but what's generally the approach, if there is a protocol?
Yeah, as they were saying before, and I don't think that ever changed, was try not to put them on a ventilator. That's always been the guiding approach, to try to avoid it if possible.
Yeah.
And so most of the hospitals have the high flow, it's called the vapotherm, and it's just really high flow oxygen. And that's really been the gold standard. Some of my hospitals don't have that, so they have BiPAP, but they put little filters on it so nothing's getting out. And those two have been pretty good. I actually have not, and of course, if you have to intubate the COVID patient, you have to intubate them. But those two have worked pretty well, sufficiently well. The terrifying thing is, I think thinking about getting it, you hear all these stories of physicians that get it, and you don't get to see anybody. I'll tell you, there's this chilling day I had a few weeks ago in New Mexico where I just went out of the ER just to get a breath of air. And you see this whole family standing outside the wall of a hospital, like eating pizza and just standing there. And I was asking my nurses what they were doing, and there's a window on the opposite side of that wall. On that wall, on the opposite side of it is the ICU. So that's like the only way they could see their loved one was through that window, because patients aren't allowed in, And so that's really the worst part, is seeing these people going in with no family, super sick and terrified, like absolutely mortified. But like I said, I think it's gotten better. People have been doing a lot better with oxygen, with the vapotherms, the BiPAPs, but it just becomes, like we mentioned before, capacity. Like we don't have the beds, the ICU beds, and the capacity, and then that leads to the transferring. And I've been transferring from New Mexico as far as like Oklahoma and beyond to Colorado, because there's no beds anywhere. And El Paso, we transferred everywhere because nobody has any capacity. And that's the really terrifying part, because what ends up happening then is then everybody sits in the ER. And then what happens when more people check in? So.
Wow. So how do you transport them? By flight or by?
Yeah, if they're really sick, if we can do ambulance if they're stable, but if they need to, by flight, yeah. But we have really good unit secretaries that can start working on the bed, and we sort of eyeball them and then look at them. They look like they're going to be admitted, call the hospitalist. They're probably no beds. So while the blood work and x-rays are being done, we just go ahead and start the process. So there's not a delay.
Unbelievable.
Yeah, that's crazy.
And we're still seeing, like everybody else, the people that you never thought would have COVID that have COVID. Yeah. And then the people, I tell everybody, and I tell my residents and everybody, the test should pretty much confirm what you already know. So if they look like COVID, if their blood work shows COVID, if their x-ray shows COVID, the test is negative, they have COVID. So you have to also play this game of and that part is sort of rewarding, is being a clinician again, and really going with your instinct and putting all the data together to say this patient has COVID, I don't, or you don't have COVID, or whatever, so.
Sure. Yeah, and we can, we could be wrong, but I mean, you've got to use your best guess. It's interesting you just said, just about the mask and earlier, and I had a couple people, different types of people, ask me, "Are you scared?" I'm like, and I've told Kevin this. I'm like, I'm not scared when I put my seatbelt on. I'm just taking precautions. It's just normal, routine thing. And funny thing is, I've had a surgeon and a surgical tech have both become COVID positive this year, and I had no evidence of COVID, but I worked in the same room, obviously wearing my PPE, and so, I have a belief that it can decrease or mitigate the risk. So anyone that tries to say it's all about fear is like, I'm not going to play that game. This is just
that goes back to what Rip was saying, though, about not letting your guard down, though.
Yeah.
Because it would be really easy in that scenario to say, these are my colleagues, it's not a big deal, I don't have to wear my mask. But
that's not how the virus thinks.
Yeah, the virus just loves it. It kind of reminds me of the whole STD thing, right? And it's like, oh, I'm safe, I haven't slept with anybody. Oh, okay, well, you sleep with, I've only slept with one person, but they slept with 32, and they slept with,
they look clean, they're pretty.
Yeah.
Or you should maybe do a public service amount, compare this to STDs. Maybe that'll
Yeah.
get people's attention. I don't know.
Yeah. Or I talked to an anesthesiologist that's out in the Midwest and said that it's like a hot spot there, and these crazy people are just like wearing their masks over their mouth, and all of them are like have their nose sticking out. It's like, dude, do you not understand that you breathe through both of them? Where do you find it when you get tested? Anyway.
That's the first thing I do. When I walk into the room, the first thing I do is I walk up to the patient and I take their mask and gently pull it over their nose. Half the time they have the mask on upside down, which is fine. It happens. And then singe it together, give them a little pinch on their nose and say, remember, if you're not covering your nose, it doesn't work.
Yes. Amazing.
But it's been frustrating, I think, and then seeing people, I've even seen people in healthcare and doing things like having weddings or super spreader. I call them super spreader events.
Yeah.
Somebody in my family, I know they're not going to listen to this, they're not physicians, thankfully, so hopefully they don't listen to this podcast, but they had a wedding and then they're both in healthcare. And I thought at the minimum, if you're determined to have your wedding and you're just not going to go back on that, maybe temperature checks, everybody wear a facial shield, limit capacity, have it out. There's some measures, maybe avoid the photos. You don't need 6 people congregating together with your grandma and dad who has diabetes and high blood pressure. And they put it on a webinar or a little web thing so you could watch it. And I was just absolutely mortified that my family and all were there just frolicking around like nothing was going on. And my mom and dad were going to go. And I'm like, I will lay down in front of your car before you go to that wedding. You're not going. The vaccine is around the corner and you're not going to get COVID. Go being irresponsible like that,
Yeah.
So
I don't understand. I mean, if it was that important, I mean, if you're going to, I don't know. My thought is there's 2 things. If you're going to be together forever anyway, just wait it out. Yeah.
Exactly. Wait it out.
Or if you have to, for some reason, have to be legally married, put it on a Zoom thing, live stream it, and just have one person that helps you, or maybe one person with you that's, been tested and whatever. I don't know. That's just my take on it.
Yeah.
Practical.
I think that's a good take because it's just so crazy. Like, and I've seen that multiple. I mean, this is so as a parent, there's people who are having, oh, my kids don't get to have their homecoming. That I'm like, do you want your kids to get get sick? Do you want your grandparents to get sick? What are you encouraging them to do to flout these? What really was a societal benefit by trying to sneak in a party for them?
Yeah,
I mean, it's just insane.
Yeah.
And what's important? What values are you demonstrating? If like Melissa, what you're talking about with what's more important, your relationship with the person you want to marry, or this big pomp and circumstance thing that can always come later when it's more convenient and people can actually enjoy it and not worry about killing each other.
Yeah, exactly. That's exactly. I couldn't put it better myself. I think it's the concept of sacrifice. Houston is open. Houston's been open for business, and I mean, you go out in Houston here, and it's like nothing's going on. And you drive by some of these bars and restaurants. It's mortifying. It's mortifying.
Like stage 5 restrictions, and people it's not really being enforced.
Yeah, exactly. And so it's just challenging. It's frustrating. And I don't wish ill upon anybody. I don't want any of my family to get coronavirus, but I just pray to God, they understand just the seriousness of this, especially with the London strain now, which I don't think is more deadly, but much more infectious. And the spread is going to be probably worse. Mm-hmm. So, which means even more so. But I think it gets back to your point about just sacrifice. Like, do you need to go to that homecoming? Do you need to have that birthday party? Wait it out. It's a hardship. We're all going through it. But
yeah, I think that's the key word, though. It's like people think they need it. Like they don't. I think that it's really revealed this sense of how well are you adept at coping with the things that life throws at you.
Yeah.
And you've got to adapt and overcome. It's like if you do have a child, and I don't have children, but I think this is and I've met a banker that said that I hope, I hate for my child to feel like everyone's going to be in masks around them. Like, okay, there's an opportunity for learning, even if they're too young. It's just part of this process that you're being a smart parent and you're teaching them that these things can happen in the human existence.
Yeah.
And this is how you behave in order to, if you're paying attention to the science and not letting politics infuse into all this, just appropriately guide your child so that they can survive in this world. That's part of being a parent.
Yeah.
But,
Yeah. And I think if nothing else, this pandemic has really showed us how much, America's a very individualistic society, how we need to be, more just thinking about other people and for greater good when it comes to something like health and pandemics. And it's really showed, I think, the lack of care we provide for our elderly populations, especially. And a lot of populations were, I think, targeted by COVID, but especially the geriatric populations, the nursing homes, just horrific, absolutely horrific. So
yeah.
It's definitely ripped apart and exposed kind of this dirty underbelly with healthcare in so many different ways and shapes
yeah,
or forms. But um, let's switch a little bit to something more hopeful, because you had some exciting news. Was it today that you got your vaccination?
yeah, I got it, I think a week ago, maybe a week and a half ago. One of my hospitals was really great, and it was just a really beautiful kind of anti what we were just talking about, where they set all the ER, ICU, anesthesia, all the people that are very, more likely to get exposed to coronavirus. And they set up appointment times. We all went in, we all got our vaccine together. And we even had administrators coming by, and it was great. They were just like, I'm not going to get the vaccine until we know that you guys get the vaccine, because we know that you guys are higher risk. And it was just a really, I can't even believe, the time we live in, where, they started the vaccine development, I think probably January, February, when the Chinese scientists shared the genetic sequence, to now where it went to market. It's really phenomenal. And the way, by the way, I don't have any stock in Pfizer or Moderna. I wish I did. Trust me, I wish I did. But but you're gonna see a Pfizer logo fly behind me. But the engineering of how they do it, I think they put a lot of thought into knowing, like, unlike prior vaccines of dead, live, attenuated virus, they probably knew a vaccine coming out this quickly, if they did a real or a dead virus, people aren't going to take it. And so to target the spike protein, which is the inactive portion of the virus, and then to make kind of the mRNA, the code for it, and for us, our body then to make that protein, which from what I understand now doesn't really vary if the virus mutates for now, was just really well thought out, really intelligent, great use of technology. And people ask me a lot, well, how did this come so quickly? And I'm like, it's got studied so well because we did such a terrible job of managing in this country. They had so many patients to work with. So many people got infected so quickly that they had massive trials. And I think the FDA recommendations were like 50%, and they would approve it. And I believe Pfizer and Moderna were over 90 to 95% effective. And so it's just really incredible, really amazing that it got here so quickly.
And I do think it's important to point out, though, is the rapidity for which this vaccine was developed is astounding. I mean, it's like moonshot, really a moonshot. But the technology that it's based on is not like it's brand new. From my understanding, it's at least 15 years old. And what's super, super exciting about this whole mRNA technology has such huge implications. So if we're looking at bright spots, there's some really huge potential with this, which are really exciting outside of COVID. But yeah, it was the moonshot of our time, I would think, in a lot of ways, was the COVID vaccine.
I believe it was originally done a lot in oncology to do targeted gene therapy for tumors. It's very expensive and it's very like specific, but when you have a global pandemic, lots of funding and tons of competition, it's just a perfect recipe for generating this vaccine. So, but yeah, I got it. I had no hesitation about it whatsoever. And I think we were talking before, I on the flip side, I can see people's hesitation for it. I'm not a big social media person, but I think it's been great. A lot of healthcare PAs, nurses, doctors are going on and taking photos to show that they are happy, they're confident in it, they don't have any hesitation in it. Because it's amazing technology. It's our one chance to get through this pandemic and somewhat get back to normal. This is the first step, really in that direction.
Yeah. It's interesting you said about the hesitation, because before it actually was released, at first I was kind of like, just like anything in medicine, there's pros and cons, risks, benefits, and looking at that. balance. And I've had hesitations in the past of the flu vaccine just because there's such variability and not really a great efficacy many times, depending on the prior year where they design it from. But when I saw the numbers of, entrusting the numbers that we're looking in the mid, 94, 95%, efficacy on these, and that and I actually had a patient before it actually got released, because I'm in Austin, and I think at UT Austin, one of the guys that was involved with some of the aspects of this vaccine, he was I guess they worked with Moderna and Pfizer to assist, but they had a lot of people doing studies here in Austin. So I had a patient who actually had gone through and got her second already.
Yeah.
So, I had some direct contact with people who actually received it before anyone was really out there getting it.
Yeah.
So, being with that said, I felt like, this might be something that I'd be okay with, comfortable with it. And so very much, I think measles vaccine, those are like in the 95% range as well, pretty high up there. So, so I actually, it looks like a lot of our pharmacies down here are getting access for the Moderna or Pfizer. So I'm on a list to be called by, I think by tomorrow, to maybe get it Wednesday or Thursday. So I'll probably getting the Moderna this week. So I'll take a photo or a video, but I have friends who, are very much pro-vaccine, and I have some friends that are kind of like this anti stuff, but I don't think they understand the science, and things are magnified in ways that are not really the whole story. So
I back in the spirit of Carl Sagan, one of my old role models, who I feel like his life's work was trying to make science germane to people, to make it palatable, understandable. And I think whenever people say crazy stuff, I'm like anybody else. I just take a deep breath. I'm trying to do like mindfulness meditation. It's not working that well, but I take a deep breath, and then I kind of go into my just going through the points that people are kind of freaked out about. And then ultimately I'll end it by just saying, just get educated. Don't believe, this news source, that source. Get trusted sources, talk to physicians, and, and then go from there, and then make an intelligent decision. I took the vaccine. I had essentially no side effects. I felt a little tired, but I also worked like 5 shifts, and I drove 2 hours, and I played tennis like 4 hours the next day. So I probably overdid it. So I was fine. I actually went up and I took a nap, and then like my parents have been calling me like every hour. I'm like, I'm just tired. I'm fine. I will be okay. But I think just educating people is the best way to go.
Sure.
There was one video I've heard people give all the gamut of excuses, and there's this video, and again, I don't do much of the YouTubing and the Facebook stuff, but it was a video of a nurse. I don't know if you guys saw this video of a nurse that fainted after she got the vaccine. Okay, good. That makes me feel good. Okay, maybe so. Yeah, I was on I think it was in Tennessee. She got the first dose at the hospital, and as she got it, she got her knees buckled and she passed out. And I was like, and she ended up having like vasovagal syndromes a lot. And I'm like, who in the right mind and the nurse came on later and she apologized. She's like, whenever I get needles, I pass out. But like, who in the right mind decided for her to be the first person on Tennessee television? COVID vaccine?
Oh my God. That's
anyway.
Insane. Hey, I'm looking in your background. Is that like a COVID molecule, like little thing in the background?
Right there.
No, the other one on the other side. It looks like
no.
COVID.
Oh no, that's that. Huh. No, it's just some random interior design piece.
Oh, that's funny. From here, it looked like COVID.
Yeah, it kind of does. Now that I think about it, yeah.
Sorry, I just had to point it out.
It looks like a dead COVID virus. It's all
right. You took care of it.
Oh, well, we've been taking up a lot of your time, Rip, and I really appreciate it. But I do have one more question to ask you, and this is, how is your behavior going to change now that you've gotten the vaccine?
Yeah, that's actually a really, really great question. I think people think the vaccine and you're cured, and that's completely not true. Number one, you still have to get your second dose. I think the first dose you're 50%, and at second dose you're at 95%. But then you still need to build immunity. You don't just get the dose and then you're good. It takes time for your body to build up the immunity. But then they also don't understand, if you get COVID, with the vaccine, can you still spread it?
Mhm.
And so, I hate to be the Debbie Downer here, and but we still need to keep doing everything we're doing. We stay away from our parents, keep distance, wearing the masks, all that normal stuff. Avoid the super spreading massive events, really until we've reached some level of herd immunity, which it's going to be a while. But this is like that first beacon of light, step in the right direction. But to answer your question, it's not going to change. It's still going to be the same stuff. And I'm trying now to take more things into consideration. Like my parents, I was initially not seeing them. My mom was getting really upset and sad, and so we made an agreement to go see her, but from outside. They wear the N95 shields, whatever. But so I've tried to make a little concessions, but not much has changed at all, and it's not going to until a while, until everybody's vaccinated. We have numbers, herd immunity, but people have to keep doing what they're doing. Yeah.
And it's not a bad thing. I do like how you said this is the first beacon of light, because someone can hear this and kind of chop to the end of the interview and get all sorts of depressed, but really the difference is we have this vaccine, and as more people get vaccinated, the less likely we'll be continually in this sort of state that we're in. So I do like your phrase that no change in behavior, but it is the positive sort of beacon that we have.
The treatment has really, it's incredible between how much we've learned, how we've been, these antibodies we have, infusions, the remdesivir, steroids, on top of which the vaccine. And so it's really man, women, humanity triumphing over a virus. So this is the first step, and it's a very promising step. And with the Moderna, with Johnson & Johnson's vaccine coming out, I think it's a great step, and it's very optimistic for us, ultimately one day combating this. So
yeah, definitely not an on and off switch. There's definitely it's a phasing in and a phasing out that takes time, and I think there is definitely some light at the end of the tunnel. Before I take us out, Kevin, did you have any other last minute questions on that question, or are you good?
No more questions. I think, well, I shouldn't say
I was going to add one
There's
more.
lots of questions.
Yeah, go ahead, Rip.
One last pitch was, we were talking about healthcare plans before. I think it's really important, and I'm just as guilty of this, for doctors, nurses to talk to people. I think we're seeing, all of us, from family strain to being with kids indoors to job stuff. And a lot of healthcare plans do have free counseling services to talk to somebody. My sister's recommended this to me. My sister's a pediatrician, and she's like, if nothing else, to have somebody sit there for 40 minutes and just listen to you babble on about these things. Some things you probably can't share with your spouse. They may just be a little too emotional. I really recommend people doing it, because we have to also, take care of ourselves as we're all going through this, together. So,
yeah, which is awesome. You just said the last word there, together. And I wanted to reference Vivek Murthy's Together book, which discusses loneliness and isolation.
Yeah. He's on that podcast, 10% Happier. I think I heard him on there. He's incredible. Yeah, he's amazing.
Yeah, very, very important. We all need to realize that we are social creatures, and that regardless of our individualistic approach in this country, we definitely need each other in some capacity, some of us more than others, but those resources, like Dr. Patel said, it's important to reach out where you can and get that help when you need it. Especially during these times when it's already stressful sometimes in medicine, just to work in the departments that you work in, but on top of it, COVID, to just make it even more challenging. So thank you again, Dr. Patel, for joining us, and I'm looking forward to another chat, I'm sure, in the future. And and for those that are chiming in on this episode, there's actually a full episode of his full story that is in episode number 69, and we are recording this in December, but his full release, our full story release, is in February, so 2021. And so make sure to check that out and hear his whole story, and I'm sure we'll have an episode down the road as well from there. But until next time, I'm Melissa Cady with my co-host, Dr. Kevin Cuccaro, and you all have a happy new year as well.